Are you worried about having a pregnancy with genetic syndromes? Do you have a family history of chromosomal abnormalities? In this video, I am diving into some crucial pregnancy tests like the anti-scan and double marker test and what's the right time to do these tests. So stay here to learn more and make sure your pregnancy journey is safe. Don't forget to subscribe for more essential tips on pregnancy care. Hello everyone, welcome to my channel. I am Dr. Monica Mangla, an MD in obstetrics and gynecology, and today I will be guiding you on some of the crucial tests done in pregnancy. One of the biggest concerns of future parents is having a baby with genetic syndromes or chromosomal abnormalities. But don't worry, we have some tests to detect them early in pregnancy. These tests are most effective when done between 11 weeks to 13 weeks, 6 days of pregnancy, because at this time the fetus crown rump length, that is the size of fetus, is between 45 millimeter to 84 millimeter. So following this timeline is very important that these tests should be done between 11 weeks to 13 weeks, 6 days of pregnancy. So now I'll discuss what are your risk factors that increases your chance of having a baby with genetic syndromes. So first is the maternal age. Maternal age is what is your age at the time of expected date of delivery. If it is more than 35 years of age, then it increases your chance of having a baby with genetic syndromes. Then if you have a history of diabetes or smoking, or if there is a family history of having babies with genetic syndromes, or if you have conceived through IVF, that is the in vitro fertilization, or if you are carrying twins or triplets or other higher order of pregnancy, then all these factors increase your chance of having a baby with genetic syndromes. Now I will explain what are these tests that should be done. So these tests are a combination of ultrasound called as an anti-scan and a blood test known as the double marker. First I will explain what is the ultrasound. This ultrasound is commonly known as anti-scan. Anti-scan means the nuchal translucency scan or known as the first trimester scan. So what do you mean by anti? Anti or the nuchal translucency. Nuchal translucency, it is a measurement of fluid behind the fetal neck, under the skin behind the fetal neck. So measurement of this fluid is very important because it is a predictor of having a baby with genetic syndromes. So we can predict if there is an increased risk of Down syndrome, Edwards syndrome, Patau syndrome, or some of the congenital heart disease, if this fluid level is increased. Then to increase the sensitivity of this ultrasound, some other parameters are added like a nasal bone or ductus venosus flow. So all these tests, when done in the ultrasound, we can predict the chance of having a baby with syndrome. The accuracy of this anti-scan is 80%. Means it can detect almost 80% of babies with these syndromes, and there is a false positive rate of 5%. So what can be done to increase the sensitivity, that is the pickup rate, from 80%? Here comes the role of the blood test. Blood test, that is the double marker. So double marker has a sensitivity of 70%. Anti-scan has a sensitivity of 80%. But when we combine these both tests together, that is the double marker and the anti-scan, they together have an accuracy of, that is a sensitivity rate of 90%. By double marker, we mean that there are two pregnancy-related hormones in the mother's blood that can predict the risk of syndromes. So these are free beta HCG and a PAPA. So we take the mother's blood sample and these pregnancy hormones are tested in mother's blood. So these values are taken plus your high risk factors from your history that I explained, age, smoking and all, they are taken, plus your ultrasound measurements are taken. Then all these values are put together in a computer based algorithm, and this is the way we calculate the risk. So this is basically a statistical risk. If your pregnancy is a low risk pregnancy, a moderate risk pregnancy or a high risk pregnancy. So basically all these tests are a screening test which predict your level of risk from a low risk pregnancy to a moderate risk pregnancy to a high risk pregnancy. And based on this result, your doctor will explain what further to do. Means if you are coming in a higher risk category, your doctor may ask you to do a further testing like a NIPT, that is a non-invasive prenatal testing. This is done by maternal blood again, or some of the confirmed diagnostic tests like amniocentesis or a chorionic villus sampling. So remember, whatever we discussed as anti-scan and double marker, they are all screening tests. NIPT is a screening test with a slightly better accuracy. And amniocentesis and chorionic villus sampling, they are our diagnostic test. So always remember to discuss with your doctor with the results if any further testing is required, and if your pregnancy is a low risk category, a moderate risk category, or a high risk category. So that's all about these tests. So thank you for watching this video. If you found this video informative, please like, subscribe and share my channel. And if you have any doubts, please comment. I would like to guide you.